How does pornography affect the perception of sexuality? Is it true that only young people can enjoy a fulfilling sexual life? Hello to all lovers of psychology and sexuality. Today, we will unveil the sexual curiosities of women. If you are interested in these topics, make sure to subscribe and activate the notification bell to not miss our future videos. Also, leave us comments and share your experiences in the section below. Let's get started. Pornography can influence the perception of sexuality by creating unrealistic expectations about sex and bodies. It can have both positive and negative effects on relationships, depending on how it is used and shared with the partner. It is not true that only young people can enjoy a fulfilling sexual life. Sexuality can be rewarding throughout life, and experience, open communication, and adaptability are key to maintaining a satisfying sexual life. Sensual massage. Sensual massages during foreplay can help relax muscles, reduce anxiety, and increase sexual arousal in women, creating an intimate and stimulating environment for sexual activity. In urban settings in developing countries, sexual and reproductive health clinics run by young people have been established to provide counseling, HIV testing, and distribution of contraceptives tailored to the needs of young populations. Sexual diversity. Human sexuality is diverse and fluid, going beyond the traditional male and female dichotomy. There is a variety of sexual orientations, gender identities, and sexual expressions that reflect the complexity of the human experience. Sexual empowerment. Actively participating in foreplay can empower women by allowing them to express their sexual desires and needs openly and without inhibition, promoting greater self-confidence in themselves and their sexuality. Sexual fantasies and gender roles. Sexual fantasies can challenge traditional gender roles, allowing people to explore aspects of their sexuality that may not align with social expectations. This can include role reversal fantasies or unconventional scenarios. Sexual pleasure. Sexual pleasure is an important part of the human experience and can manifest in various forms, including physical contact, erotic stimulation, emotional affection, and shared intimacy. Sexual response cycle. The traditional model of the sexual response cycle includes the phases of excitement, plateau, orgasm, and resolution, although sexual experience can vary widely among individuals. Sexuality and aging. As people age, they may experience changes in their sex life due to factors such as menopause, health issues, hormonal changes, and life experiences. However, sexuality can remain an important part of well-being and quality of life in old age. Sexuality and advertising. Sexuality is often used in advertising to sell products, leveraging sexual attraction and gender stereotypes to capture public attention and drive sales. Sexuality in literature. Sexuality has been a recurring theme in literature throughout history, from classic works to contemporary novels, exploring a wide range of experiences and perspectives. Sexually transmitted diseases can affect people of all ages, races, sexual orientations, and genders. They do not discriminate and can affect anyone who engages in unprotected sexual activity. Shower positions. Some women enjoy the intimacy provided by sexual positions in the shower, such as standing against the wall or the waterfall position, adding an element of adventure to the encounter. Sleep benefits. Masturbation before bedtime can help some women fall asleep more easily, as it releases relaxing hormones and reduces stress. Sleep disorders and erectile dysfunction. Sleep apnea, a disorder characterized by interruptions in breathing during sleep, has been associated with an increased risk of erectile dysfunction in some studies, suggesting a connection between sleep quality and sexual health. In certain African countries like South Africa and Botswana, specific sex education programs have been created for people with disabilities, recognizing the importance of addressing their unique health and sexuality needs. Standing positions. Although less common, some women enjoy standing sexual positions, such as against the wall or leaning standing, which can add an element of adventure and risk to the sexual experience. Stress and erectile dysfunction. Chronic stress can contribute to erectile dysfunction by negatively affecting hormone levels, blood circulation, and overall mental health. Finding ways to manage stress, such as exercise, meditation, and therapy, can help improve erectile function. Syphilis, a sexually transmitted disease caused by the bacterium Treponema pallidum, has experienced a resurgence in recent years in several countries, especially in urban populations and among men who have sex with men. Technological fetishism. With the advancement of technology, new fetishes related to electronic devices have emerged, such as attraction to sex robots or excitement over virtual reality. The health benefits of sexual activity. Consensual and pleasurable sexual activity can have numerous health benefits, including stress reduction, strengthening the immune system, and improving mood. The importance of consent. Mutual and freely given consent is fundamental in any sexual activity. It's important that all parties involved in a sexual encounter agree and feel comfortable with what is happening. The importance of sexual self-care. Sexual self-care involves making informed and responsible decisions about one's own sexuality, including the use of contraceptives, prevention of sexually transmitted diseases, sexual health care, and seeking professional help when necessary. The phenomenon of differential sexual desire. Some couples experience differences in sexual desire, where one member has a higher sexual desire than the other. Managing these differences in a respectful and understanding manner is important for maintaining a healthy relationship. The role of sexual communication. Open and honest communication about sexual needs, desires, and boundaries is crucial for a satisfying and healthy sex life in any relationship. Time of day. Women's preferences for sexual positions may vary depending on the time of day, with some feeling more energized and adventurous in the morning, while others prefer the intimacy of nighttime encounters. Timely treatment. It is essential to seek medical treatment as soon as possible if an STD is suspected, as early diagnosis and appropriate treatment can prevent serious complications and reduce transmission to others. Toys for sexual rehabilitation. Sex toys are sometimes used in sexual rehabilitation programs to help individuals regain sensation and sexual function after injuries or surgeries. Toys with shock components. Some sex toys are equipped with electrical components to provide tingling sensations, pulsations, or small electric shocks, known as erotic electrostimulation. Treatment. Treating anorgasmia may involve sexual therapy, cognitive behavioral therapy, hormonal therapy in cases of hormonal imbalances, medications to address underlying medical conditions, or a combination of these options. Types of anorgasmia. There are two main types of anorgasmia: primary, in which the individual has never experienced an orgasm, and secondary, where the individual has had orgasms in the past but no longer experiences them. Human sexuality is a fascinating and diverse field that never ceases to amaze us. Sexual curiosities unveil the wonderful complexity of the human experience in the intimate realm. As we explore and understand these facts, it is crucial to remember that each individual is unique in their sexual experience. Respecting and communicating with your partner are the keys to a satisfying and healthy sexual life. Sexual education and understanding are essential tools for fully embracing our sexuality.